Hello everyone. Today let's talk about acute epiglottitis. Acute epiglottitis means that is the inflammation of the acute, it is an acute condition and that is the inflammation of the epiglottis. And it is one of the most serious upper respiratory infection in children. And the most common age group that is involved in this condition is 1 to 3 years. 1 to 3 years means that is a toddler age group. And the most common etiology is Haemophilus influenza type B bacteria. So the most common etiology is Haemophilus influenza type B and the most common age group is 1 to 3 years and it is one of the most serious upper respiratory infection. Let's see what are the clinical features in this condition. This condition is sudden in onset and there will be high fever and the child will look toxic. These are the three things that you have to keep in mind. It is sudden in onset, high fever will be there and it is a toxic, child will look toxic. And stridor should be there obviously because there is a blockage in the upper airway, so stridor will be there. And 3 Ds you can remember. Dysphagia will be there, drooling of saliva will be there, distress will be there. Dysphagia because there is an obstruction, so it will be difficult to have something to eat and all. So drooling of saliva, there is a blockage in the backside, so the saliva will be coming out through the mouth. And distress, upper airway obstruction is there, so distress will be there. And the child will be seen in tripod or sniffing position. So it is called tripod position because it looks like this tripod. The tripod is I have given on the right side and you can see the child's position on the left side. It is called tripod or sniffing position. It is one of the characteristic position the child will assume. Like while the child is coming to the OPD, you can just observe this position of the child. So by that only you can identify the condition. Coming to the diagnosis part, it is diagnosed by direct laryngoscopy, but whenever we are doing the direct laryngoscopy, we have to be careful because it can precipitate, it can cause respiratory arrest also in the child. So it should be done with precautions, with caution, proper cautions. And in the direct laryngoscopy, we can observe cherry red epiglottis that is seen in the left side. And also we can diagnose it through X-ray. In X-ray, we can see the thumb sign. You can observe the thumb sign in the slide. So in X-ray also, we can just diagnose acute epiglottitis. Coming to the management part, we have to establish airway because the main problem of the child is having is the airway is obstructed and the child is in distress. So first of all, we have to establish the airway. Then it is a infective condition that we have told, Haemophilus influenza type B. So we have to give IV antibiotics. The most preferred IV antibiotic here is 3rd generation cephalosporin. Thank you.